The National Institutes of Health and Dr. Anthony Fauci have concluded with, quote, a high degree of confidence, end quote, that President Trump is no longer shedding infectious coronavirus.
The debate over whether the president was still infectious is an issue that a lot of people are facing as survivors return to work, school, and other aspects of life. Dr. Frank McGeorge is here to clear up some of the confusion over that issue for the president and everyone else. Hi, Doc.
Hey, Kim and Jason. Yeah, let's start with the president's situation. His physician reported that he developed symptoms on October 1st. Now, normally, 10 days of isolation would be routine. The reason for the extra scrutiny over the president is that at least based on the treatments that he received, he could be considered as having severe illness, which could extend his isolation to 20 days. So officials are now going to extra steps to justify his earlier clearance. So what about other survivors? Well, here are some of the questions I'm hearing about this important issue. If someone has a mild or moderate case of COVID-19, when is it safe for them to be around other people? The CDC guideline that will apply to the majority of healthy people who test positive with mild to moderate illness is that they need to isolate for 10 days from the start of symptoms, not the date of testing. The isolation will be longer if you continue to have fevers or your symptoms are not improving. Now, what if someone has a severe case that requires hospitalization? For people who are immune compromised or have severe illness, it's been shown that they can continue to be infectious for as long as 20 days. If that's your situation, you should remain isolated for at least 20 days from the onset of symptoms and be free of a fever for at least 24 hours and have improving symptoms. Why aren't survivors required to test negative before returning to work or school? Wouldn't that be safer? At the start, we did use 2 negative tests 24 hours apart to indicate someone was safe to come out of isolation. But over time, research showed that a significant number of people stayed positive past 10 days, even though doctors could not grow any infectious virus from them beyond the 10 days. That's why the CDC no longer requires negative tests for clearance. Now, if someone does have 2 negative tests 24 hours apart before their isolation period is done, then they frankly are no longer considered infectious and they can complete their isolation sooner. Now, it's important to note, when an infected person is cleared to leave isolation, it's still important that they follow all of the guidelines, including mask use, distancing, and hand washing, because rarely someone might still shed virus past 10 days, and we've also now seen very rare reinfections.
So, Dr. McGeorge, then how absolute are the guidelines on when it's safe to leave isolation?
Well, you know, Kim, they're not absolute at all. They're guidelines. Judgment should always supersede them. For example, one of the criteria to leave isolation is improved symptoms. Well, if someone's smell and taste are back and their muscle aches are gone, so they're improving, but they're still coughing every time they open their mouth, I would say there's still a risk and they should talk to their doctor before leaving isolation. So everything is relative and everything requires judgment.
Yeah, you have to keep that in mind. Okay. Dr. McGeorge, we thank you.